In the case of the federal mandate, if successful, this will be the first time in American history that Americans will be forced to buy a product from a privately held company for profit. I'll say that again. The first time in history that Americans and Floridians will be forced to buy a product from a company. In 1994, when the Clintons tried to move federal health reform through, they tried something similar to have an individual mandate. We've heard a lot about the nonpartisan Congressional Budget Office. The Democrats of Washington have relied on passing this current bill last night. At that time, the Congressional Budget Office declared these type of mandates, and I'll quote, "A mandate requiring all individuals to purchase health insurance would be an unprecedented form of federal action. The government has never required people to buy any good or service as a condition of lawful residence in the United States." Yes, this is the CBO saying that. Now you might wonder, what might the founders of our country say about this? In 1787, 223 years ago, there was a physician named Dr. Benjamin Rush. He was the Surgeon General of the Continental Army, signed the Declaration of Independence, and he was a delegate to the Constitutional Convention. He tried to have medical freedom put in as a key addition to the Constitution. He issued a warning at that time, and I'll quote, "Medicine, if we don't have medical freedom, could become, quote, an undercover dictatorship and force people who wish doctors and treatment of their own choice to submit to only what the dictating outfit offers." Despite his good efforts, Dr. Rush he missed the opportunity to protect future Americans, or to avail them of such a precious freedom. We have an opportunity today, members, take the first step to give Floridians medical freedom, which, in my opinion, should be on the same level of rights as freedom of speech, freedom, gun rights, freedom of religion, and other sacred freedoms that we hold so dear. The bill has already passed 2 committees in the Florida Senate, and with your vote today, we can put this bill on the way to success in the Florida House and protect the freedom of all Floridians. Thank you, Mr. Chair.
All right. Thank you, Representative. Now, to get us in the procedural posture, members, that's the explanation of the bill. We have an amendment to the bill, and I would ask you to explain the amendment, or your previous comments explain the amendment that's before us.
Okay, there's one amendment, and that is to change the date from January 1st to March 1st, which helps protect previous and existing programs, which is a technical amendment. And then the other one is we're moving it from Article 10 of the Constitution, where the drafters put it, to Article 1, along with other basic rights for Floridians.
All right, members, are there any questions on the amendment? All right. Any objections to the amendment? Seeing none, show the amendment adopted. We're back on the bill as amended. Members, are there any questions? Representative.
Thank you, Mr. Chair. Representative Flaken, you mentioned that this has never been done before, mandating health coverage. What about PIP, where we mandate everyone to have PIP? So if your bills were to pass, would we do away with PIP requirement?
You're recognized.
Thank you, Mr. Chair. There has been some suggestion in trying to compare this to auto insurance. Yeah. And auto insurance versus this is a voluntary activity. Like we require, in some states require certain types of auto insurance to be bought, but you do have a choice of whether you drive or not. You don't have a choice of whether you breathe or not. Now, if specifically, that was just brought to our attention, if PIP is an issue here in Florida that we need to specifically carve out, not at this stop because I just saw it Friday, but we might consider some type of amendment to carve that out, if that is a concern. I think by excluding everything before March 1st, it covers that, but I'd be glad to work with you before the next committee stop to try to address that concern.
Thank you. Follow up, Mr. Chair.
Follow.
With regard to workman comps, that's the same thing too. We mandate every employer to have workman comps. So would this bill do away with that?
You're recognized.
Thank you, Mr. Chair. Again, it excludes any programs that are in place prior to March 1st of 2010. And if there was an additional concern, we could do an additional carve-out.
Mr. Chair, I'll follow up, please. Right now, everyone is mandated to have health care when they walk into emergency room. And if your bill was to pass, would we leave doctors or ER from providing emergency care to people who just want them?
You're recognized.
This simply does the two things I had said at the beginning. It gets taken to a lot of different places. It preserves our right to make that choice. It also gives the same right to medical institutions that they have the right to accept payments and to provide services. Under the plan just passed in Washington, it puts severe restrictions on that. And again, this doesn't address that whole plan. It just simply maintains these two rights that we should be able to make that choice. So I don't think it in any way affects what you're talking about.
All right, you're recognized.
Thank you. Again, would emergency care physician or emergency facilities have the right to refuse services to someone who walked in and can have to uninsured patients?
You're recognized.
This bill does not address that specifically. Again, this is not meant to address all of healthcare reform. It's simply to preserve these two basic rights. It does not enumerate that they have the right to refuse, so existing law would apply, whatever that is, including the federal plan.
You're recognized. We need to, other people want to ask too, so.
One more, thank you. You mentioned the failed system in Massachusetts. Massachusetts has 4.1 uninsured, 4.1% of uninsured individuals. How many people in the state of Florida are uninsured, to your knowledge?
You're recognized.
Okay, the state of Massachusetts, I listened to the treasurer of the state the other day say how this is destroying the budget of their state because of these mandates it puts on the state budget. Now, certainly we have a large number of unemployed people, uninsured people in Florida, like all other states do. However, Massachusetts, the mandate is routinely being ignored. There's been polls of the citizens that say that they don't like it, it's not effective. And again, it comes down to the basic right. If you're saying here in the state of Florida that we should force people to buy insurance and be like Massachusetts, then I suggest we could go that route. But many of us believe that that's an infringement upon our liberties and that there's other types of health care reform that could be effective without infringing upon our liberties.
Mr. Chair, if I may clarify my question?
Well, do you have another question?
The same question, but it wasn't answered.
Well, you can have another question.
Thank you, Mr. Chair. My question to you is that your bill analysis that was prepared stated that only 4.1% of the population of Massachusetts is uninsured. Do you know the number, how many people are uninsured here in the state of Florida? And also you mentioned that there are other ways to address this issue. If you would elaborate on those, the many ways that you know of that we can address our uninsured situation in the state of Florida.
You're recognized.
Mr. Chair, this bill is not about that. Now, certainly it is well known the Republicans in Washington have initiated a number of different ideas, such as buying across state lines, allowing small group pooling, and they're well known in the press. But this bill is not about that. This is very simple. We are just trying to, despite other what types of healthcare reform there are out there, to preserve these basic freedoms that we get to choose. That's it. It's a 3-page bill. It's not 2,000 pages. And it simply says we should be able to make that choice. And that's it.
Representative Raymond-Linda, you had a question.
How many people are uninsured in the United States? Do you know?
You're recognized.
Well, I don't think that that's germane to this bill, but I'll say what I've read in the media. There's anywhere from 20-some million to as 50 million if you include illegal immigrants. That is what the media's reported. But again, that's not germane because we are for healthcare reform, just not the type that takes our liberty and freedom. So there are tens of millions, I would say, would be a fair number, low tens of millions.
Do you have a follow-up?
Yes, sir.
You're
Mr.
ready.
Thank you. What is the ultimate jurisdiction of the United States federal government? Is it to protect the health and welfare and safety of these United States?